Africa's public health landscape is again at the center of global health attention, with a series of actions now in play to stem the spread of MPOX. This week, the Africa Centers for Disease Control and Prevention will officially declare MPOX a public health emergency of continental concern. This is expected to be historic since this is the first time that the center will be making such a declaration. Similarly, a closed virtual meeting of the Emergency Committee convened by the WHO Director General under the International Health Regulations 2005 regarding the upsurge of MPOX has been set for Wednesday, 14th August 2024, starting the official process that could lead to declaration of MPOX as a public health emergency of international concern by the Director General of the WHO. In this episode, I'm joined by Aggrey Aluso, who is Pandemic Action Network's Director for Africa Region. The conversation focused on Africa's rapidly evolving public health landscape, particularly in relation to the MPOX outbreak. We discussed the challenges Africa faces in responding to infectious diseases outbreaks and the need for increased capacity and resources, highlighting the importance of early action and collaboration both within Africa and globally to contain outbreaks. The conversation also touched on the need to prioritize health in national budgets and the role of civil society in holding governments accountable. My name is Paul Adepoju, and I welcome you to this episode. So thank you very much for accepting to talk to me. And I think I would like you to start with an introduction to your organization and what your organization's current perception regarding Africa's rapidly evolving public health landscape at this moment looks like. So that is a good way I would like us to start this conversation.
All right. So my name is Aggrey Aluso. I work for Pandemic Action Network as the Director for Africa Region. I also lead Resilience Action Network Africa, which is a network partner for PAN. That's the short of Pandemic Action Network. So PAN is integrating and supporting the emergence of Resilience Action Network Africa to really anchor the advocacy work that is being done in Africa around the pandemic PPR and other adjacent issues that impact or that can be that impact the health and global health security and Africa health security in particular. So in terms of our perception on the evolving health situation in Africa, of course, because we're very concerned and very invested in supporting efforts to enable Africa really be resilient in its management of health situation, in the view of the fact that we're having a surge in infectious disease outbreaks in Africa. We've been concerned that in the recent past there's been quite a big increase in the number of disease outbreaks without commensurate political voicing or support, and with the understanding that there is need for Africa to really ramp up its capacity to detect, contain, and generally respond to these threats. But that capacity has remained very, very low, despite a lot of publicly stated intentions, including the Africa Union's new public health order aspirations. And of course, the latest outbreak that currently has caught the continent's attention is the MPOX, something that has been endemic in Africa for quite some time. With first cases registered in the 70s in the DRC, and of course, its different mutations have become more deadly. Of course, we about the global public health emergency of international concern around MPOX, which was in 2022, that was in all over the world, not just Africa. And of course, the current mutation or the current variant that is currently spreading is really, really of a great concern because it has really rapidly spread from the Central Africa region, where it has been mostly endemic, to other regions within Africa. Of course, the latest or the last data that I was interacting with was showing that there were more than 12 countries. There were about 12 countries that have reported cases. And, of course, Africa CDC has really stepped up, mobilize action and really get, the emergency response process in motion. We are concerned that this has come a little bit too late because it's been evolving since May. And, when the cases in South Africa were showing very high cases of fatality, and of course, the cases in DRC have been very fatal with, very relatively high mortality rates. Case fatality rates, it has not attracted the necessary attention that we thought it should have by now in terms of the political pronouncements and the response from the relevant authorities, both within Africa and globally.
Yes, thank you very much. So I would like you've touched an aspect that I think is really, really critical. And when we take a retrospect of the various conversations around the best lessons for Africa from the COVID pandemic, you will see the reportage being that Africa has learned to prioritize health and all of those kinds of arguments that suggest that Africa is now uniquely positioned in terms of making advancement in its public health security. But how do we balance the impact of Africa's response on the COVID-19 pandemic to what we are currently still doing in light of MPOX, still calling out for support and interventions from global health organizations, while still not being able to quickly rally locally available resources to respond to it. So how do you balance the perception that Africa really gained a lot with the COVID pandemic with the current response to the MPOX?
Thank you for that perspective. I think that's a very important point to reflect on. Of course, at the peak of pandemic, and with the realization of the inequities and injustices that were witnessed, where Africa was really at the back of the queue for all the essential countermeasures to contain COVID, there was quite an outpouring of a lot of commitments and aspirations, some of which I've mentioned, including the new public health order, the plans to really ramp up Africa's capacity to manufacture its own vaccine, the partnership for Africa vaccine manufacturing, and of course also harmonizing the regulatory environment so that they can remove hurdles that were identified to be in that realm of regulatory environment. And of course, enhancing the capacities of the national and regional public health institutions were some of the ambitions that have been set, and of course, shoring up the health workforce capacities, both in terms of the numbers and in terms of the skills. But as you rightfully point out, I think it's not reflected in terms of how we've been able to respond to these latest outbreaks. And of course, cholera has been in the background, has been smoldering for the last nearly 2 years in the southern Africa and getting into Eastern Africa with a lot of devastating impact as well. And now MPOX is here, and there are many other public health issues that are in the background, not as significant as these two that I've mentioned. One thing that probably we can give credit to Africa Union for is really giving the political support to Africa CDC. So I think that autonomy and that support that they've given Africa CDC has reflected in terms of the coordination of the continental response. So in terms of being able to voice where the need is and trying to rally resources and actors, I think that we will give to Africa CDC that we've seen some change in terms of how they coordinate and how they show up in those spaces. But in terms of the actual, tangible, substantial resources needed, that is still very, very wanting. The ambitions to have, very functional hubs I know in their in their joint emergency response plan, they joined emergency action plan, the one that they developed together with WHO. They had very robust ambitions around, how they were going to, transform the emergency response capacities in Africa, including, ensuring that countries have functional public health emergency operation centers. And they had ambitions like about 90% of those centers should be functional by 2026. I think the latest evaluation show that very few of such centers are functional, and the hubs that were to be created to, to really coordinate, because I think what we are facing in Africa really this cross-border transmission of infectious diseases. We've seen it's peaks from one region and spreads very quickly to the other. So really, the hope is in having very robust transnational coordination mechanism through the hubs, where they're able to mount, coordinated surveillance and having stockpiles of essential countermeasures that they can use to, within a very short time. They had ambitions to reduce the supply chain, barriers, like I think typically they had noted that it takes about 20 days to get essential countermeasures to the spots where they're needed. They want to use that to the 24 and 48 hours. That has not happened, largely from those operationalization. Things have been very slow, and I know the hubs are picking up, but they're not, I think they are at a very nascent. I can't confidently say where they are, but we've not seen that function being deployed in the current outbreak. So different countries are struggling, and if you hear statements from the affected countries, all of them are, just, I'm sorry to say, fumbling, saying what needs to happen, but they don't have the tools. What we've had most recently is that some 50,000 doses of vaccines were availed to DRC. 50,000 against a population of 99. If we had moved very quickly, and if Africa had really been, entitled learning and deploying the lessons, we should have moved much, much faster when this current outbreak was reported in May, because that's like 3 months. And we have these ambitions of 717, which I'm sure you know about. So that does not reflect really in terms of how we are responding to outbreaks. And I think our best bet in a resource-constrained context like ours is to really move quickly to contain them, detect and contain the outbreak before they spread, because it becomes very costly to now deal with all these countries that are now impacted, and you can't really, be sure that you are doing something that is effective without the necessary tools. We don't have diagnostics. Our laboratory systems are not up to speed to really, identify, do tracking of the pathogens that are being monitored. So it takes a long time to even ascertain what you're dealing with in any jurisdiction. So I'm not a medic, but I understand mentally from the reports that are filtering through. It's taking countries inordinately long to even ascertain that, this country has reported one case. By the time they're doing that, probably it's taken 10 or 20 days to going through borrowed processes of taking samples from one country to another country to do genomic sequencing to know what they're dealing with. So that has really slowed us down. So it's, sorry to say that we are not confident as citizens or representatives and citizens organizations that Africa is still deploying the lessons learned. We still out there with our begging, begging both, asking for foreign support. We've not had, of course, there's been some little money approved for use, $10 million that has been approved by African Union, but that's a little too late, too little and too late as well. They should have really helped contain this outbreak in DRC where it had started. Yeah, so we are not happy with, we're not confident that we are really learning from COVID the way we should have. And the world is also not learning as well, because the solidarity-based approach that was one of the key lessons that the world learned. But a threat anywhere can be a threat everywhere in no time. They know the reaction should have been much quicker. from the global community as well. Of course, African leadership is paramount here, but the global community's reaction has also been very slow. And we know stockpiles of relevant vaccines are in some countries. But, as you heard from the WHO Secretary General, there's still negotiations in terms of how that can be availed, and whatever has been availed is very little to be effective.
Yes, thank you for your honesty. Then, something I also wanted to talk about is localizing global health response, and I think there are different global recommendations around how things can ideally be done. Then there is a difference regarding the reality at the front line in Africa. So how and to be able to have the best outcomes, I think localization of these guidelines and these recommendations and interventions are the best way forward. But we continue to see a lot of responses, advocacies around this MPOX outbreak response to be centered largely on encouraging access, improving access to the vaccine doses. But it seems as if we are building the hype of our global health response, especially on the continent, around just making people have access to even experimental vaccines that have been approved for emergency use. Are you concerned about this particular pattern and prioritization?
Yeah, so I think our best bet as a continent and as a global community is to, for really efficacious global health security, capacity to respond, is to enable different regions of the world to have capacity in the dispersed spaces where these outbreaks occur, so that we don't have to outsource, tools from other places. So that has proved not viable, and we saw, when the world is threatened, when people hear of an outbreak somewhere, they start preparing themselves for a potential infection in their territory. So they would not want to avail their tools to the other, lest they be caught unawares, or lest they exhaust their capacities before before they are able to replenish their stock. So we've seen that that tendency to really retreat inward, and the nationalistic tendencies that characterize COVID response have not gone. And I think it makes public health sense it may not make business sense. And I think that those are usually the two tension points, because we've seen innovations are largely driven by market potentials, and the public health dynamics don't operate in the same way. The areas that have the least market potentials are the areas that are likely to even have outbreaks, and you've seen that happening in Africa. Some of the data I've seen recently is that the countries that are likely, there's the ranking of vulnerability to infectious disease outbreaks, or outbreaks of diseases of high significance, of high potential for pandemic. 22 out of 25 countries that have high vulnerability in disease outbreaks are in Africa. And yet Africa is a place where we have the least, endowment in terms of the tools to detect and contain these outbreaks. And I think that is just self-defeating for the global health security agenda. It's really incumbent upon us. Africa should provide leadership, but the world should have it in their interest that countries that have vulnerability to outbreaks are supported to have capacity to produce countermeasures within their territories, so that they can be able to deploy them quickly, when they detect those outbreaks. And that has been one of the slowest progresses, even in the conversation that are currently happening at the INB, the intergovernmental negotiating body to negotiate a pandemic agreement. The most contentious issues are around this capacity sharing, technology transfer and know-how transfer, and IP sharing. Yet, for me, I think that is where we would really have the best opportunity to, secure the world's health security. Because if we wait for few countries to manufacture these countermeasures and go through all these very long bureaucratic steps to avail them to those countries, we will continue having this situation spiraling out of control unnecessarily. Like now we are having something that should have been contained in May is now a very serious problem in September. Are you seeing the gap? Yet we are even talking about 100-day mission. We are talking about 717 kind of, turnaround time. Those are very important timelines in terms of responses, but they'll only make sense if we really, really genuinely put ourselves at operationalizing those intentions and supporting the currently very weak territories or weak countries in terms of the capacity to produce those countermeasures, to acquire those capacities and be able to produce them. And I can't fail to point out the responsibility that the Africa leadership has. I think Africa leadership needs to lead by example. We still have a very lowly, more likely externally funded Africa CDC. We have intentions that have been stipulated in terms of, setting up an Africa Epidemic Fund that would really avail these such financing capacities that would help in supporting the peacetime preparatory processes or preparedness initiatives that would, build capacities of countries within Africa to be able to, develop this capacity if that fund was available. But that fund remains empty. It's not been operationalized. So that leadership, leading by example and really owning this commitment is something we'd really want to see from the African leadership.
On their,
And the
on
world.
its Yes,
Yeah.
I think so. In their support, I think Africa CDC said the continent is responding in real time to several outbreaks at the same time. For instance, there is MPOX, there are suspected cases of Ebola, there is also cholera outbreak that you've mentioned. In Nigeria, the Lassa fever outbreak, the number of
Yes.
cases has nearly doubled what was recorded last year. So we are seeing loads of countries compelled to be responding to loads of outbreaks at the same time with
Within
their
their territory.
limited. Putting this in context, what do you think is a realistic way to strengthen Africa's ability to respond to its numerous outbreaks at the same time and still be able to prioritize preventive measures that could still safeguard it against further escalation, like what you just said is happening with this MPOX outbreak?
Yeah, so I think definitely our best opportunity is in collaboration, really pulling this is a shared risk. So we really need to socialize that understanding that these risks are shared. So it's not Nigeria to be dealing with Lassa fever. It's not DRC to be dealing with MPOX on its own. We've seen how they quickly cross borders to the others, Yet our responses have been very nationalistic, even within Africa, despite the intentions and the efforts of Africa CDC. It is true, they are overwhelmed by the internal pressures of the infectious disease. And of course, we know the levels or the sheer volume of infectious diseases that are currently being reported in Africa is increasing. Like I'm told, I've made to understand is over 100 per year lately, in different jurisdictions. So each country is up to their neck with this. But I think our best bet is really realizing that we need to use the insurance principle in this context and really pool our resources and look at our risks in a more aggregated way and work with that continental aspiration of collaborating and creating hubs that would help us manage these things, collectively and collaboratively. And I think the global community, the models of global cooperation for health, and I don't want to call them development assistance for health because I think these are shared responsibilities. So, we are not assisting somebody, we are assisting ourselves. And I think that concept of global solidarity for enhancing global health security needs to be rethought. And how funds are channeled or resources are pooled together at the global level and supporting regions that are currently vulnerable should be done in ways that is premised on the understanding that we are helping to ensure global health security. So it's not doled out, through philanthropic conditional gestures that often have been done with very vertical, programs that do not support the holistic health system, strengthening, and therefore does not help us to have a resilient health system that is able to detect and contain pandemics or pandemic threats, as well as managing endemic challenges that are really crippling Africa's capacity to respond. Because Africa carries the heaviest disease burden in the world. Like 25% of the global health disease burden is domiciled in Africa against a population of about 16%. So clearly, Africa is choking, and with a lot of other competing challenges. But we really have to rethink global cooperation for advancing health security, because if we don't rethink it, we will continue this vicious cycle, and it will it's like driving and you constantly looking behind. Even those countries who think they are okay, if you're driving and you're constantly looking back to see whether that neighbor of yours is throwing stones at you, or has let the dogs out so that we may bite you, you will crash. We need to, I think, for them to be sure that things are okay, they need to work with the vulnerable regions to ensure that we get these things managed in ways that will help us have better assurance.
So we see Africa CDC saying that it's on track to declare this outbreak a public health emergency of continental concern next week. And we are also hearing that this may also be, the WHO Director General may also be doing something similar at the end of an emergency committee meeting that he is convening. So where do you stand, or how do you think this should actually proceed? Do you think what we currently have now, constitutes a globally relevant public health emergency? What are the changes what are the actionable items that you consider top priorities going forward? So do you agree with where we are going right now, and what do you think the focus should be?
Yeah, I think absolutely. It's actually late, to have declared this global health emergency of international concern. One thing we have consistently been trying to push through is, not waiting until it's too late to trigger these necessary actions. We have to find a way of evaluating potential threats and activate action early enough before they go beyond certain number of territories to warrant it being called a global health emergency of international, because that is too late. We need to find avenues of triggering action much sooner, and then having a very clear phased approach to help the regions that have recorded or that have registered those incidences that portend potential global health security threats being supported to contain them. Because now it is in 12 countries. Coordinating surveillance across 12 countries is more than 12 countries, is just sheer, very, very, it's a nightmare. And chances are it's already spiraling into other regions. So for me, this is it's a very important thing to do, and I support the action. I actually think it should have been done much earlier. Probably Africa should have done the continental declaration much earlier, and then the world can do it later if Africa has not managed to trigger necessary action to contain it earlier. So it should be phased so that these regions can do their earlier declaration, and then the global architect can now do when it's really out of control. But my thinking is that it's very, very important. I support the actions, and I just think it should have become earlier, and it should have been triggered earlier. In terms of what needs to happen after this has been declared, and of course we don't even need for it to be clear. I think this should be happening as we speak. I think the world really need to activate its solidarity mode. We really need to deploy the lessons we learned from COVID and realize that when your neighbor's house is on fire, you better assist your neighbor put off the fire in the house, because that fire will quickly catch your house as well. And we don't want a scenario where the whole village, global village, so to speak, is putting fire in their own houses, because that we are yet to recover from COVID, impacts of COVID, and we don't want the world to go through that direction again. So the world really needs to rally to mobilize resources to support Africa, and Africa needs to lead from the front in terms of mobilizing the human resource. We really need human resource, such human, health, human resource for health mobilization to really be deployed. We need the tools that can help track and detect this spread and contain them before they spiral out of control, even if it means deploying mobile laboratories. I've seen mobile laboratories, very high-tech mobile laboratories in West Africa. I was recently in Pasteur Institute, the IPD Institute Pasteur de Dakar, and I saw a very sophisticated mobile laboratory. I think we need to use those kind of capabilities. And they were explaining how they had used that to, get samples in far-flung remote areas and able to help trace or track, spread of, high-impact pathogens. I think we need to deploy those kind of capacities in regions that are impacted. And I know they're expensive, but it's worth the investment. So the world really needs to rally behind Africa, and Africa really needs to move with the world, need to lead from the front. And we need to avail the necessary resources, particularly diagnostics and vaccine. Therapeutics, I understand, are not available, but I know we have vaccines and we have diagnostics, and we need to ramp up our surveillance capacity to track and detect cases so that they are able to be managed before they go out.
Okay, thank you for that. We'll come back to that, but I want to push you to get your thoughts on these vertical responses going on at the same time. There are different schools of thought. I know when we were hearing about the demographic insights around this particular outbreak, we know that Africa CDC reviewed that in countries like South Africa, the highest mortality rate is seen among key populations, men who have sex with men, and which accounts for the significant proportion of the cases and suspected deaths in the country, and which brings, because of the impact of the HIV pandemic. So we are seeing these expected to be vertical responses, response to HIV and response to MPOX, now overlapping in some cases. And we also see that elsewhere, we're told too that in some countries where children are also being affected, issues like malnutrition is putting the children at a disproportionately high risk of mortality. So when we have these cases conditions that are expected to be separate, that are now being overlapped, how do we integrate these epidemiological insights into our overall global health response strategies, in terms of should we continue to still be looking at these issues individually, or how do we use the fact that they actually have epidemiological overlaps to guide the way we respond to them?
Thank you. I think that's a very intriguing observation that I've been also seeing in the trend. So in different regions, you're seeing different demographies being impacted disproportionately. So I think in DRC is more of the children. I was getting some information that, like in some zones, it's like 75% of the infections are like children, and then the mortality is more than 60% in children. And then in the Southern Africa region, it's amongst the men who have sex with men, gay men, and bisexual men. And I think the common denominator there is the pre-existing marginalization and vulnerabilities, as you rightfully point out. So it will manifest differently. So in the instance of DRC, it's children who are already having underlying challenges like malnutrition or other, other pre-existing health challenges. In the South Africa context, there are people who are already marginalized, in the health system, and already probably living with very advanced HIV, and already presents itself as underlying condition that is then aggravated by this new emerging health challenge. So really, it's actually just point out to what we've all been trying to say. in as much as it makes sense to have some affirmative response for populations that are disproportionately impacted, historically marginalized populations, or disproportionately impacted population. But at the same time, we have to lend equally significant amount of effort to support the health system, broadly, to be resilient enough, so that we won't have, if it was in every situation where there is an emerging challenge, the pattern is that the marginalized populations are the ones who get disproportionately impacted, or people already facing certain trends of marginalization are the ones who get disproportionately impacted, or their condition gets aggravated. So really, in as much as this will really present another very potentially challenging response, particularly in South Africa, where people will start blaming certain populations. So that's a risk that we have to now factor in the communications, because people will quickly start blaming certain populations for bringing a new pandemic. But we've seen that is not the case, because in DRC, the children who are being impacted. So we have to be very careful in terms of how we do the analysis and how we make the communication on, because from what I can see, it's something that is magnifying pre-existing challenges, and that really reinforces the realization that we need to strengthen the system. So with the marginalized persons in mind, so that they are not disproportionately impacted whenever we have any new challenge being reported in the health system. But also it shows it's a lesson that the global health institutions need to now learn, that in as much as we have very deserving, very legitimate obligation to support issues that are very, very pressing at that particular point, we must lend part of our effort to help strengthen the system. Because when we deploy a lot of resources in just that vertical issue, when there's a surge, when there's a burden or a crisis that erupts like this one, our progress is regressed. We witnessed regression, like we saw during COVID, where we saw that HIV and TB trends regressed to the level where they were like in 2012 in some regions, in terms of the infections and fatalities and so on and so forth. So I think we continue learning, and I hope we really plow these lessons into practice, so that we work with more system thinking rather than just issue linear or vertical issue thinking that has characterized our response so far.
Yes, thank you very much. So let's talk about what your organization is currently doing on the continent. So what are your groundwork? What does it look like? And how do they integrate into the global health landscape's current focuses?
So our work mostly is around mobilizing collective action to really push duty bearers to do what they're supposed to do, in terms of really remaining committed and really fulfilling the obligations that they have to build a resilient health system that can guarantee our health security. So we largely an advocacy organization, and we mobilize stakeholders across different thematic interest groups that have some concern about the current state of health security in the continent, but also at the global level. And therefore, we continue to work closely with Africa CDC. We mobilize CSOs and we create interface sessions with them. For instance, at this moment in time, we are in consultations with them to ensure that the CSOs are represented in the task force to bring the community perspective, because a lot of times you just have experts and then you miss very important parts of what needs to be incorporated in the design of the interventions. We also mobilizing political, support or political attention, because as I mentioned at the beginning, we see very lackluster response from the political class. It's been technical folks responding, Africa CDC, the public health institutions. At this point, we really should have had, some leadership from the heads of state level, like we saw during COVID when President Kagame and President Ramaphosa really stepped up. We've not seen this. Maybe I've missed something, but we've not seen this in this MPOX, case. And we are currently trying to mobilize our constituencies across different countries to push their governments to really pronounce themselves on this situation and avail the maximum of possible resources that can be availed to help respond to this, amongst the other challenges that they are dealing with. I think also at the global level, we are mobilizing the global community to really push for better response. So you may have seen we just released a letter with other stakeholders, call to action that went out yesterday with the former chairs, the chair of the independent panel that had been formed in the COVID during the COVID pandemic, and other high level stakeholders in the global health security space. And we will be holding a series of conversations like with the media houses like yourself, just to voice what needs to be done. We hope to have convenings bringing different stakeholders to chat the way forward. And we would be moving into the phase where we want to really push aggressively for, the global action to avail the necessary tools to bring the current outbreak to an end, to a swift end. Should have ended, but unfortunately we are where we are. So we would really want to push for countries and actors and stakeholders that have capacity to do something, to do whatever needs to be done to bring this current outbreak to an end before it spreads further to other regions. Yeah.
Yes, thank you. Then I'm curious to know, we've been, to me, it feels like we are at a stalemate as far as galvanizing response, local response for public health issues is concerned on the continent. Let me give you an instance. Before the COVID pandemic, we had this Abuja declaration that 10% of Africa's countries' national budget should go to health. Even we had Ebola, we had a lot of diseases that were geared towards encouraging African countries to say, okay, yeah, this is a big deal. Let's put that, let's start considering that. But that did not happen. COVID came, and since the COVID pandemic, following the COVID pandemic, we've seen a lot of health budgets of African countries, yet a lot of them, majority of them are still not, if COVID could not get them to increase their budgetary allocations for health, what do you think needs to happen then? So do you think, how will you rate the progress in convincing African governments to prioritize health, to put more local funding into health so that they can have more localized say on how health issues are funded and initiated and or carried out in their respective countries?
Yeah, I think that has been the biggest challenge, and many of us, the civil society organization, usually say, very lofty pronouncements if you're not going to measure them, if you're not going to, assign resources that measure up to the commitment that you're making. And I think that's exactly what we've been seeing in Africa, including making declaration of how much they're going to invest and not investing in those things. So really, I think the citizens also have a role to really play in making their governments know that this is a priority for us, and if you don't fulfill it, we are not happy with you and we will not reward you.
Thank you so much for accepting my invitation. Please keep in touch so that we can always have this conversation as this pandemic and other public health topics evolve on the continent. Thank you so much.